Good afternoon, everyone. My name is Stefan Wheat. I am an emergency physician and faculty of the Department of Emergency Medicine at the University of Washington in Seattle, Washington. Specifically, what I'd like to talk to you a little bit about today is about a solution that I designed and developed, rolled out, which is called ClimateRx. And this is the solution. Very simple. It is a badge-enabled campaign, which is designed to help promote conversations between patients and between providers and their patients and between different providers around climate change at the point of care in clinical spaces. And it is currently a US-based campaign, and we have currently almost 10,000 healthcare providers from all different disciplines, pharmacists, social workers, nurses, physicians, using this tool to help spark those conversations between themselves and their patients in clinical spaces. And I'm joined here by Dr. Ali Saad, who is a user of this campaign, as you can see, and he's going to be sharing some of his perspectives as well. And after Ali speaks, we're going to watch a brief video mashup of testimonials of healthcare providers from all over the U.S. who use this badge and use this badge to help spark those conversations with their patients and hear their thoughts on the campaign. But before we do that, and before I turn it over to Ali, I want to do a couple things. I want to couch this conversation in the larger conversation that we're having at COP, right? Because ultimately COP28 included, it is a policy-oriented conference, right? The main drive of this is the negotiations, which I think we have to remember. But ultimately, for me as a clinician, policy, while I very much appreciate and I love that there are people that care about this and make this a big part of their career, that is not a part of my oath. My oath is to my patients, and remembering that is, really what drove me to create this campaign. Second, I want to share a couple of stories, and these stories are meant to help us remember that this is not an abstraction for us. The problem of climate change, the health effects of climate change are not an abstraction for us as healthcare providers. We see these patients, in our clinical environments all the time. And I want to share a couple of the stories, both from the clinician angle and the patient angle. The first story is in reference to extreme weather event that occurred in Washington State in 2021. I'm referring to the heat dome that affected the Pacific Northwest. And this is an extreme weather event that has been identified as being virtually impossible without climate change. And so what I think that kind of allows us to do is say that the over 400 people that died just in Washington State, recognizing this impacted Oregon and British Columbia and other parts of the Pacific Northwest, the over 400 people that died in Washington as a result of this heat wave died because of climate change. All full disclosure, I was not there in 2021, but talking to my healthcare providers and the voice I want to bring forward here is that of the healthcare provider. My colleagues now that were working during that time, they paint a picture of a healthcare system that was totally overwhelmed. One of our medical centers reached crisis levels, standards of care, and was almost at the point of breaking during this 2-day period when this heat wave was the most intense. And when I talked to my colleagues about their experience of that and how challenging that was for them, what they communicated and what was communicated to me multiple times was that in comparison, especially since this is something that happened during the COVID-19 pandemic or kind of just on the tail end of the most severe period of the COVID-19 pandemic, what they said is that this 2-day period was more intense, more traumatic for them than anything that they experienced during during the COVID-19 pandemic. And that really hit home for me, because I remember how awful that was for me, and I can't even imagine. Second, I'd like to turn to another extreme weather event that occurred in Washington in 2022. This is the Bolt Creek Fire. This happened in September of 2022, and this was a very unusual wildfire, because this was a wildfire that occurred in Western Washington. And for the people who are not familiar with the Pacific Northwest, and Western Washington is one of those places that is beautiful in the summer, and people come to visit in the summer, and they're like, I absolutely want to live here. And then they try, and they come and live through the winters and give up and move back to somewhere with more sun. And it's a very a wet place. We get a lot of rain. It makes it a very beautiful green space. And that means that wildfires, particularly late season wildfires like the Bolt Creek Fire in late September, are extremely unusual. And in this case, most can be attributed to the drought and the heat and the dryness of the summer that came as a result of climate change. And the story I want to bring forward is a story of a patient that I saw in my emergency practice in Washington State, who literally was running from his life. This is a mountaineer that was climbing in the Cascades in Index, Washington during this fire. And he saw some smoke kind of coming up over the hill across the valley. And then pretty shortly after that, he saw the flames. And before long, him and his partner were literally having to run for their lives to try and escape this fire. And I saw him, fortunately, both of them escaped. I saw him because he had taken a fall as they were literally running for their lives, and had multiple abrasions and contusions, head injury, and lacerations that needed repair. But that seemed like, to me, a very direct patient result from climate change. So with that, and before I tell you a little bit more about the Climate RX campaign, I'm going to turn it over to Dr. Ali Saad and let him introduce himself and share a little bit about his perspective about his work and the campaign.
I think this one does it.
Yeah, there's one.
Okay, there we go. So I'm Dr. Ali Saad. I'm a neurologist living in Denver, Colorado, and I'm affiliate faculty at the University of Colorado's Climate and Health program. And Stefan said something super important, that a physician's primary duty is towards their patients. And although me and Stefan and many of our colleagues have dedicated our time to working in the climate and health space academically, doing research, meeting with people in positions of power, we represent less than 1% of physicians, or really any healthcare professional in the world, and even in the US. And so what I like about Climate RX is it brings the conversation and it brings the focus back to the everyday interaction between the healthcare professional and the patient. And they're not necessarily extreme examples like what Stefan described. So I'll wear my Climate RX badge, and sometimes people ask me, oh, what's this? They don't even necessarily scan the QR code every time, but we start a conversation. And so we can start talking about the climate and health intersection. And it's got to be done in a way that is already able to integrate into what naturally happens in the patient-physician relationship. So if you go to a busy physician, you tell them, hey, this is another thing you have to care about, that's a hard sell, especially on a busy day, which is most days. Whereas if you tell them, let's focus on the patient's health, let's focus on getting them to walk, to bike, let's get them to focus on eating healthy and getting proper sleep, and let's do it in a way where we're keeping climate health and planetary health in the back of our minds. Because when we're encouraging a healthy diet, like let's have people eat more plants, not necessarily vegan, just more plants, we can reduce greenhouse gas emissions from our agricultural sector by 50%. We can reduce our land and water use by 70% in the US. So these are climate co-benefits that are happy side effects, but we're still focusing on the patients. And what I like about Climate RX and the patient-focused approach is we're not asking doctors to do anything new. We're saying, keep doing what you're doing, provide the best medicine, which is preventative medicine. And in doing so, you're also going to help the planet. And you're ultimately reducing the risk of people developing chronic diseases like asthma, like stroke, like heart attack, like diabetes, and ending up in situations that are very carbon intensive, like a inpatient hospital stay.
Thanks, Ali. So next, I would like to just turn a little bit towards kind of the origin story of Climate RX. And I think in order to kind of explain to you why I came to this solution, I think you really have to understand the problem. And the problem that I saw, and this is a problem that you see in the United States, but I think plays out everywhere in the world, is that most clinicians, that is physicians, pharmacists, nurses, they recognize that climate change is a problem. They recognize climate change is a health problem for their patients. And they think that they have a responsibility to communicate that risk to their patients. And yet, for the majority of those people, they are not taking that next step to actually initiate those conversations with their patients. And I think what's most troubling to me is that, and this is anecdotal, but what's most troubling to me is that even the people that I know who I, just have conversations with and who are actually, knowledgeable about this issue, when I ask them how often they actually, they're, doing interesting research, they're doing, interesting policy work, and they're educating their students. But when I ask them how often they're actually talking to their patients about this issue and counseling their patients around this issue, they say fairly rarely, right? It's a fairly rare occurrence. And so if there is this problem of this gap in, we know it's a problem, but we're not addressing with our patients, we have to what is the problem there? What is the barrier? And I think the first barrier, of course, is, an education barrier. Most clinicians still don't know or don't feel confident that they know enough to be able to counsel their patients around this issue. And that's just an education barrier. The majority of medical students and other health professionals around the world did not go through their training program learning almost anything about this problem. So it's difficult to expect them to start that conversation. But more specifically, there are essentially 3 different barriers that have been identified to the initiation of conversations in the clinical space between providers and their patients. The first one, of course, is what I just alluded to is knowledge. Most clinicians do not feel that they are confident enough or that they are that they can speak authoritatively about this topic. Second, we're all really busy. Everyone who is working in a clinical environment, we already have so many tasks that we have to take care of. It is hard to go to a provider and say, do more. And third is this actually false impression that most clinicians have that they think that they're the only ones that care. They think that they're the only ones that would want to engage their patients around this issue, and that they fear that their fellow clinicians and their colleagues would judge them for doing so. And so when I was designing this campaign, I had all of those barriers in mind. And I think this campaign addresses each of those barriers because, first of all, when we address the knowledge problem, the reality is that we don't, not everyone is going to have the privilege of getting to participate in a year-long, fellowship like Ali and I did to learn about this problem in detail. But so many clinicians care. And all you have to do to participate in something like this and engage your patients meaningfully is to wear this badge. And to wear the badge, it starts the conversation, and then they can scan the QR code. If you're not comfortable and you don't have all the knowledge yourself, you can refer them to scan the QR code, and they can learn everything they need to know, or much of what they need to know to get started on, their learning journey around this through the QR code in the website. Second is time. This campaign is designed to be non-interrupted. I'm an emergency physician. The demands on my time are extremely strenuous, and it's hard for me to imagine sitting down and having an extensive conversation with my patient around this topic. But I don't have to. If all I need to do is start that conversation, or have my patient ask me about the badge, allow them to scan the QR code, and then again, they can learn on their own, because you have that captive audience in that clinical environment, whether it's in the hospital or the clinic. And then finally, that perception that you would not be supported in engaging in this kind of issue in the clinical space is also addressed through this campaign, because when you walk around and you see your colleagues wearing something that very explicitly says, this is something I care about, and I care about communicating this problem to my patients, it helps to address that problem as well. It creates a visible community of practice around this issue at the point of care. With that, I think we'll go to the video. I'm hoping that we'll be able to hear the video, some of the music going on. But this is the video mashup of testimonials of healthcare providers who use the Climate RX campaign. Can we pull up the video, please?
Hi, my name is Sheetal Rao. I am an internal medicine physician.
Hi, my name's Emily. I'm a medical student.
As a professor of nursing.
Hello, hey, I'm Mark Vossler. I practice cardiology.
Hello, my name is Dr. Ali Saad. I'm a physician, board certified in neurology, stroke, and lifestyle medicine.
Hi, my name is Milagros Elia, and I am an adult nurse practitioner and the program manager of Climate and Clean Energy at the Alliance of Nurses for Healthy Environments.
Hello, my name is Dr. Tomiko Katsumoto, and I'm a rheumatologist on faculty at Stanford University. I am passionate about educating my patients and fellow healthcare providers about the impacts of climate change, which is the greatest threat to human health of the 21st century. I wear my Climate RX badge regularly in clinic and have distributed several badges to colleagues. The Climate RX badge offers an easy way to bring up the topic of climate change with patients. With simply scanning a QR code, it affords quick access to a fantastic website that provides a lot of practical, actionable, and evidence-based advice for both patients and healthcare providers on ways in which we can better prepare ourselves for climate impacts such as severe weather events and poor air quality.
And I use Climate RX in my clinic. I put it on the back of my ID card, just like this. And when I have patients in clinic that might be at higher risk of heat-related illness, for example, I will mention to them to exercise caution. If they have additional questions about how climate change impacts their health, I will just show them the badge and they can scan the QR code.
Today, I wanted to talk to you about Climate RX. I very often use my Climate RX badge to spark climate conversations in professional spaces where they might not have existed before.
I've been proudly wearing my Climate RX badge for the past year. The places I find it most effective are low-stress situations where I can have a leisurely conversation with people, like airports, trains, and professional conferences. Because it's worn in the same place as an ID badge, it catches people's eyes and is a great icebreaker.
And I use the Climate RX badge in the hospital and in clinic to talk to both my patients and my colleagues about the relationship between climate and health. The Climate RX badge is great because it's not only a good conversation starter, I even carry a couple extra to hand out to colleagues so that they can grab a badge as well. But the QR code also provides really great links so that people can learn more about the issues.
The Climate RX badge is a simple and very effective tool that helps us start conversations with patients about the important health effects of climate change and actions that they can take in their own lives to address these health impacts.
But what I have seen is that it initiates conversations with my colleagues, with other doctors and nurses about the health impacts of climate change. And you know what? Most everybody I talk to is concerned and they just don't know what to do. And what I say is, well, the first thing you need to do is talk about it. Do what I'm doing. Wear the Climate RX badge. Talk to your colleagues, talk to your patients. Let them know that climate change is a health problem and that together we can solve it.
Furthermore, Climate RX offers wonderful guidance on how to get involved in advocacy efforts as a way of affecting positive change in our community. The Climate RX website describes climate solutions for your home and neighborhood. For example, advice on saving energy, optimizing travel by walking, biking, or using public transportation.
Earlier this year, I was sitting next to an engineer on a plane. He asked what my Climate RX badge was for, and this led to a great 15-minute chat. Being an engineer, he also wanted to know if I had any hard data that I could briefly go over with him. Scanning the QR code on my badge, I was able to go over a few high-yield graphics on climate change's impact on health. This interaction gave me the opportunity to clarify some misconceptions, and my new friend was grateful to have learned something new. This is an example of how Climate RX is an easy and effective way to show people that I'm a trusted expert in climate change's impact on health, and I'm open to discussing it with them. But it also puts the ball in their court and allows them to start the conversation if and when they choose to. For people that want to know what personal actions they can take, I'm able to offer individualized mini prescriptions right on the spot that benefit them directly, but also happen to be climate smart. I like to wear 2 badges back to back so that it's always visible. And for people that want a badge, I can simply detach one and gift it to them.
Climate RX helps me to link other health professionals to evidence-based information and resources that they can use to better understand the issue of climate and health and how to protect their patients. I like Climate RX because it democratizes the climate and health movement. Not everyone has time to be an expert, but the majority of us care deeply about climate change and how it's impacting our patients. All you have to do to be a Climate RX champion is care and wear the badge.
The Climate RX badge is a really excellent tool that can be used by nurses and other healthcare professionals to help start these conversations.
I think Climate RX is great because it's evidence-based, it's free, it's easy to use, and it doesn't take time out of the clinical encounter.
I'm really grateful to be able to provide this resource to my patients and to my colleagues so they can better care for their patients. And I highly encourage you to get involved with the Climate RX campaign and get a badge for yourself.
Wearing the Climate RX badge is a great way to both actively and passively communicate that climate change is affecting our health, and it opens the door to further conversations that enable us to more easily discuss climate change topics that can help our patients.
I love to recommend Climate RX to my colleagues because it makes advocating for climate solutions in healthcare easy, visible, and it creates a community of support around this issue. Best of all, Climate RX is free. Any health professional can sign up to receive their free badge in the mail. So I invite you to order yours today and join me and hundreds of other colleagues in making a difference. Thank you.